watching Let's Chat.
You've heard us speak a number of times about the great work they do at the Austin Hatcher Foundation for Pediatric Cancer. There's a lot that goes into what they do at the Austin Hatcher Foundation, and we're going to talk with two of the folks who help make this magnificent machine roll on. Tammy Gibson is here, and Tammy is an occupational therapist. And we also say hello and good morning to Dr. Chastity Chartier, who is a clinical psychologist. Ladies, good morning to you both.
Good morning.
Good morning.
First of all, thanks for everything you do for the Austin Hatcher Foundation. And the more I find out about this group, the more I am intrigued. Tammy, first question up for you this morning. What sort of impairments can become present after treatment for pediatric cancer, and how do you help address those impairments?
Yes, well, unfortunately, children not only deal with the treatments from cancer, but afterwards they have long-term effects. And some of those can include difficulties with tolerating different sensory stimuli, difficulties with tolerating a lot of noise or chatter in the background, and even focusing on task or their ability to do what we call higher level executive functioning skills like memory or problem solving, things that they used to could easily do. Sometimes they have more difficulty after having received treatments. So those are some of the areas that we can focus in on and help them while they're in therapy sessions.
As we have mentioned before, occupational therapy doesn't just treat the patient. It also, by extension, has to treat the family and especially the siblings, correct?
That is so correct. So unfortunately, when a family has an individual in their family that has cancer, it doesn't just impact that one person, it also impacts the siblings. So therefore, we look at all aspects and how maybe those siblings during that time have missed some major developmental areas and just need some help and support between getting their confidence back, doing some of the tasks they used to do. And those are the areas that we want them to do. Our goal always with occupational therapy is to help them be able to do whatever they need to do to live life to the fullest. So, and that's what we do here at Austin Hatcher is we look at whatever needs they may have so that they're engaging and the family is working again as a unit and overcoming these obstacles.
Dr. Chartier, tell me about the implications of pediatric cancer beyond the obvious and the cancer treatment on the cognitive function itself.
Mm-hmm. Oh, well, unfortunately, the treatment itself, it's not very good at targeting just, the bad cells, but it also targets cells that we need to function appropriately in the brain.
Right.
So while the treatments have become very effective, the long-lasting cognitive effects have remained.
Tell me a little bit more about how this affects everyday life of the cancer patient.
Mm-hmm. So one of the primary areas of the brain that's affected is the frontal lobes because they are the last area of the brain to develop, and that is where our executive functions exist. Your executive functions you use to control every other aspect of the brain. So your planning, your organization, your focus, all of those things are really affected, and I'm sure you can imagine how difficulty focusing and difficulty planning, self-monitoring affects you in the school setting, your ability to learn, your ability to function, later in life when you're trying to hold a job to work. It affects your social skills, so it really has a far-reaching effect.
And just like the patients and their families are continuing to find out more about this on a day-in, day-out basis, so are the folks at the Austin Hatcher Foundation. Tammy and Dr. Chartier, thank you both very much. You can find out more about these great ladies and the work they're doing at the Austin Hatcher Foundation. The website is hatcherfoundation.org. That's hatcherfoundation.org.
Thank you.